Uh, the third part is pathophysiology, because this part is complicated to understand. So there are no requirements in teaching. If you are interested in this part, you can study yourself according to the PPT. And in terms of pathophysiology, it's often divided into three stages. The first stage is acute exudative phase. In this stage, if it's treated in time, it can be cured. Otherwise, it will develop into a proliferative phase and a chronic fibrotic phase. There are no clear boundaries among the three stages. They are sometimes interconnected and overlapped. And in the following parts, it contains the pathophysiologic feature and the further pathophysiologic change, and pathophysiology and the pathogenesis. So you can learn this part by yourself according to the PPT. And it must be noted that acute lung injury, or ARDS, is not a single disease, but rather a pathophysiologic syndrome. And in the following three parts, it includes clinical features, diagnosis, and treatment. And then the most important part is the treatment. And although the following parts, including the clinical features and the diagnosis, are not required in the textbook, but it's very important for the understanding of the disease. And therefore, I hope you will spend some time to study the following two parts. First, let's study the clinical manifestation of the disease. The clinical manifestation of acute lung injury can be divided into four stages. In stage 1, the patient has only symptoms of the original disease. At this stage, if the primary disease is not treated effectively, it will develop to mild dyspnea and even respiratory distress. And with the development of this disease, it will eventually develop to severe respiratory distress. And in this stage, the treatment is not only very long, but also ineffective. And the most common clinical features include tachypnea and progressive dyspnea, arterial blood gas. Analysis shows hypoxemia and hypercapnia. And due to the lack of oxygen, besides progressive dyspnea, patients often experience tachycardia. And the radiographically bilateral lung infiltrator stratus can be seen in chest X-ray or CT. And the following part is diagnosis. Diagnosis is the premise of acute treatment. If we can't diagnose the disease, and we can't perform the acute treatment for the patients. And the diagnosis of acute lung injury depends on the following aspects: clinical features, chest X-ray or CT, and respiratory dynamics, and blood gas analysis, and the right cardiac catheterization. And for the respiratory dynamics, we can see two changes in the patients with acute lung injury. The first is the decrease of lung compliance, and the second is the reduction of functional rescue capacity. And for the blood gas analysis, it's also very important to diagnose the disease with acute lung injury. And the blood gas analysis reflect oxygenation and ventilation of the lung for these patients. Swan gas catheter is an important tool to evaluate the right cardiac function. And if the pulmonary capillary wedge pressure, we also call PCWP, less than 10 millimeter Hg, and it often reflects the loss of right cardiac function. And just as I have mentioned in the beginning, image is very important for the diagnosis of acute lung injury in surgical patients. And these pictures are typical features for acute lung injury in stage 4. And in these pictures, we can see the double lung consolidation and infiltrators. And once the disease develops to stage 4, the most the vast majority of patients require treatment in the intensive care unit. In the ICU, the Swan gas catheter is usually used to evaluate the severity. Swan gas catheter is often located in the pulmonary artery. And the Swan gas catheter can be used for the measurement of the cardiac output, right arterial, pulmonary arterial wedge pressure, and the mixed venous oxygen contents. Another indicator is oxyhemoglobin dissociation, and which can reflect correlations for pressure of oxygen and the oxygen saturation in blood. And the last indicator is acid-base balance, which can reflect the microenvironment. And oxygenation index is very important for the diagnosis of acute lung injury. And the oxygenation index is the pressure of arterial blood oxygen divided by the inhaled oxygen concentration. And it's the diagnostic criterion for acute lung injury. And when the index is less than 300 whatever pip, we call it acute lung injury. And when the index is less than 200 whatever pip, we call it ARDS. And we know ARDS is a severe stage of acute lung injury. So the index change reflects the disease development.